Good afternoon, everyone. You're very welcome to this session. The session is entitled Global Perspectives on Patient and Public Involvement in Dementia Research and Projects. My name is Iracema Leroy. I'm a professor of geriatric psychiatry at the Global Brain Institute at Trinity College Dublin, and it's my tremendous pleasure to be hosting this session today. So what we will have over the next hour are some fantastic presentations from members of the Global Brain Health Institute and their patient and public involvement partners, talking about their work and their partnerships. The goal of the GBHI of Global Brain Health Institute is to address brain health challenges globally. An absolutely core and critical part of our work is ensuring that the lived experience of people with dementia around the world informs our work and is at the heart of what we do. And we hope you will see this in the examples of best practice of PPI around the world from members of GBHI. So we'll have a few presentations, after which we'll have a panel presentation in a panel discussion from some of our members, and we will address some of the key issues facing the practice of PPI globally. So to start off with presentation one, we have a dialogue between lived experience and the scientific data as a pathway to change. And this presentation is from Lithuania, led by Ieva Pečiuka, who is one of our Atlantic Fellows for Equity in Brain Health. She's co-founder and lead of the National Association of Dementia Lithuania, and has been extremely active as an artistic researcher and creative director in the dementia space. She'll be co-presenting with Jolita Vatine, a mother of two girls and a daughter to her mother who has frontotemporal dementia. She's worked as a nurse in a care home in Norway before returning to Lithuania to support the care of her mother. And alongside the Association Dementia Lithuania, Jolita has been a very active advocate for the need for change in the carer support system. So I'm going to hand you over to them and enjoy the talk.
Hello, everyone.
Hello.
I am delighted to share this presentation together with Jolita Vatine, and we will be talking about transformative change by really making people with lived experience voices heard. And I want just a quick note about the country we are coming from, me and Jolita. Lithuania, a northern European country with less than 3 million population, with rapidly aging, and it is considered a high-income country with predominantly Lithuanians. It's one of the most homogeneous countries in Europe. And we represent here Association Dementia Lithuania, founded very recently in comparison with other European countries, just a couple of years of work. And the vision of the organization is Lithuania, where all efforts are put to reduce the risk of dementia, and people living with dementia and their carers feel valued and supported. And by now, we have created a community of around 800 people, which has to say that around maybe 5 of those are people with lived experience, which says that there's enormous stigma in the society. And also, we really expanded our collaboration with organizations in Lithuania, but also outside of it, with partnerships established with 2 really international partners, Alzheimer's Disease International and Alzheimer's Europe. And the experience we will be talking today is the roundtable discussion that happened very recently, September, celebrating World Alzheimer's Month. And the topic of this event was Dementia, No One's Business. Is it time for a national dementia strategy? This event was hosted in our parliament, Seimas, and one of the parliament members was the patron of this event. And Jolita, well, as in general, this event had an objective to advance dementia strategy and the conversation around that, also present the results of petition, where all society was invited to sign a petition to advance dementia strategy in Lithuania, and also to discuss the different aspects related to dementia with stakeholders from different fields. And Yolita played a really important role in this conversation by sharing her experience in within the path of living with dementia. And I want to invite her to this conversation now. I will stop sharing my slides and have a couple of questions to share to her. And the first question would be, how would you define your role in this event?
Kaip jūs apibūdintumėte savo vaidmenį šiame įvykyje?
Dėkoju, Dominikai. Aš buvau pavyzdys, kuris parodo teorijos ir praktikos esmę.
I was the example that showed the basics of of theory and practice at play.
Ir susikirtimo taškus, kas tinka ir kas netinka.
And the crossover point of things that are appropriate and things that are not.
Kaip yra iliustruojama realybė be teorijų.
How reality is portrayed theoretically.
My other question would be, why there is a mismatch between the theory and the practice?
Bet kodėl yra nesutikimas tarp teorijos ir praktikos?
Teorija, kuri yra deklaruojama, nėra išvystyta atsižvelgiant į žmonių situacijas.
The theory that is declared or talked about is constructed without having any regard to people's situations.
Taip pat patirties aplinkybės.
And there are circumstances of experience.
Yra dažnai deklaruojama, kad paslaugos yra ir jos yra prieinamos.
It is often announced that services are available and that they are accessible.
Tačiau itin dažnai pasitaiko, kad esamos paslaugos netitinka realios žmonių situacijos.
But what actually happens is that the services that do exist, they often don't match or comply with the requirements that people may have.
Ir atskirtis yra ta, kad jomis būtų galima pasinaudoti ir pasinaudoti be rūpesčių, tai yra ganėtinai sunku.
And what separates this from what we're talking about is that if anybody needed the service, it would be in practice very difficult to attain.
Vienas iš pavyzdžių, kuriuos mes apibūdinom renginy,
One example that we have talked about during the event
kad paslauga yra, bet ji nėra būtent tai, kas man buvo reikalinga, kas mums reikalinga.
that the service was existent, however, it was not the type of service that was needed by us.
Ir bandymas išgyventi tiesiog kasdienoje vis tiek pritempia prie to, kad mes tą paslaugą imam.
And just the mere urge for survival was something that pushed us to actually accepting it at the end of the day.
Ir tai yra, tas pritempimas yra pati didžiausia problema tiek paslaugos tiekėjui, specialistui, tiek mums.
And that urge is the very problem that affects not only the service provider, but us as well.
Nes dalis darbų jam tiesiog nepriklauso pagal pareigybės.
As the job description of the provider would not include various things that were actually needed.
Ir susidaro uždaras ratas, nei mums gerai, nei specialistui.
And it would create this vicious circle of no one benefiting each other. So it's improper for the specialist and it's improper for us at the same time.
Bet tokia yra kasdienybė ir mes esam priversti laikytis tokios sistemos.
But this is our day-to-day life, and we are compelled to adhere to this system.
The last question to you, in your opinion, what was the impact of this event, Jolita?
Jūsų nuomonė, kaip tas įvykis paveikė?
Renginys buvo labai stiprus,
The event was very strong.
Nes buvo sukviesti žmonės iš visų pusių, iš įvairių pusių pamatyti būtent demenciją.
There were people gathered at the event that were representatives of all kinds.
Pamatyti su demencija turinčių asmenų priežiūrą.
All kinds of areas to do with dementia, to examine the areas where it had to do with services for dementia.
Iš skirtingų aspektų ir skirtingų pusių.
And various different aspects and all sides of it.
Nes ten buvo žmonės ir globėjai, ir iš sveikatos specialistų, ir politikai.
As it included carers as well as health specialists and politicians.
Thank you, Jolita. Just thank you for expanding that. We have been presenting the perspective of the professionals alongside the situation analysis with really the data presented like numbers and facts. And that your sharing absolutely really allowed us to see how that theory lands on the people's lives. Thank you so much for sharing and having this conversation with me. And here I would be ready to pass to the other speaker. Thank you to Dominikas as well for his help.
Taip, mes turime visus tos duomenis ir ačiū labai, kad pasidalinote visą šią informaciją ir mes taip pat tą patį matome iš duomenų.
Thank you, Jolita and Eva, for a very interesting conversation and for highlighting the importance of ensuring that dialogue is in place to move the agenda forward. And Dominika, thank you also for your wonderful, clear translation. That was absolutely fantastic. So we're moving on to presentation 2. So this comes from South Africa. So first of all, we have Kanya Ngobo, who is an Atlantic Fellow for Equity in Brain Health, who's in our program last year and recently returned to South Africa. She was my mentee in the program, so I'm feeling very proud that she's speaking here today. And she will be joined by Zetu Makatini, a family and systemic psychotherapist, and who works in dementia and mental health, and is a founder of the Bessie Makatini Foundation, an NGO in South Africa supporting people living with dementia. And so as you can see from their title slide, they'll be telling us about unraveling the mysteries of dementia in our communities. Over to you.
Good afternoon, everyone. I am Kanyo, as Ira has said, and thank you for having us on the panel. We'll just be discussing, as the title says, unraveling the mysteries of dementia in our communities, and our situation and what our response has been. So just firstly, to lay kind of a foundation. So South Africa is the southernmost country in Africa. We have a population of more than 60 million people. And in this population, it's multi-ethnic. We have 11 official languages. And with those official languages come maybe in the forefront different cultures. And different cultures having different belief systems as well. So why is dementia care or dementia management important in our country? So South Africa has the largest population of elderly people in its region. And this is estimated to increase to close to 14% by 2050. And we know that one of the risk factors of dementia is aging. And there's a lot of factors that are not ready for a surge, but also currently are not serving our population. So if we look at the challenges in dementia management in South Africa, we have a couple. So we have a low dementia awareness and cultural stigma surrounding the disease. So there's very low awareness in the community and at population level about dementia. And with different cultures, there's different stigma surrounding the disease. So issues such as believing that the person has been bewitched or bewitchment, and this leading sometimes to serious violence and sometimes even death because of this. There's also no official government strategy on dementia care. So when we look at standard of care, care pathways, model of care, that's not really something that we have and not really something that is practiced. Also, there are challenges with cognitive screening tools. So looking at their validation, looking at level of education, looking at language, which also then impacts on how people are screened, how many people are screened and diagnosis and going forward. The dementia services are under-resourced and welfare systems are poorly developed. So there's also low dementia awareness in the welfare and social department. And then this leads to being under-resourced and also people living with dementia and their care partners struggling when it comes to accessing and utilizing resources. There's also the dementia training of healthcare professionals is also sometimes not optimal. And then there's a paucity of dementia research. So all these factors and all these challenges speak to why we need to do more dementia research, but also work towards improving the situation of dementia management, of dementia care, and supporting people living with dementia and their care partners. So I'm presenting with Zetu Makatini, and I'd like to now introduce her to carry on presenting with me and explain what her and her organization are doing to respond to the challenges that we have in our society. Welcome, Zetu.
Thank you. Next slide, please. Well, thank you for the introduction. Thanks for being here. So I am Zetu Makatini, and I live and work in the UK, where I'm working in community mental health team for older people with functional mental health and dementia. But the reason why I set up this organization, which is in Lamontville, because my own mother had the illness in 2009. That's when I realized that there was very, very few services for people living with dementia. If you have the money, of course, you can get the best service because we've got the best doctors, the best services for people with money. So I felt that it was very important to target this service for people disadvantaged, even though I didn't feel that it was disadvantaged because obviously I live abroad, but then I was aware around me that a lot of people had very little knowledge about dementia. That's why I set up this organization to support people living with dementia in our communities and also people with their carers. Thank you. The next slide, please. So what I realized that there was a need for raising awareness in the community because people know very little about it. So we set up a number of programs. So the first one, which is very important, is raising awareness in the community. How do we do that? We go out in the community, we go to churches, schools, we do memory walks, we use the radio stations to go and talk about dementia, and the radio stations have been much more effective because this is where we get most people who respond to us after hearing us talk about dementia, sort of communicating with the public, and we will get a lot of referrals. People will be calling us asking for some help because they heard us talk on the radio. So it's the most effective way of actually reaching out to the community. But we also work with hospitals and also traditional healers who can refer people that are concerned about. So when we do get those referrals, obviously we do the screening because we need to identify people that need some support. And then the ones that may need to be referred to hospital, we make those arrangements. And we're very lucky that we've got a formal arrangement with certain hospitals in Durban where people can just be supported to go and be diagnosed and given a formal diagnosis. But the most important thing that we do, it is about offering support to family members. For some of them, they may not even need to be assessed because they've got a diagnosis, or maybe the person is at an advanced stage where going to hospital is not going to make much difference. This is where now we offer psychoeducation. So we run support groups, face-to-face, and WhatsApp support groups for people who cannot travel to where we offer the support. So it's on 24 hours. People share information, they share their experiences, they learn from each other. We have that, but we also meet with family members or sort of make direct calls to families who may need support. So like a therapeutic kind of support. So as a family therapist, that is where my role is very, very important. People's form support groups or maybe sort of WhatsApp groups, and then we can actually involve a lot of other family members. We also have what we call a Friday group, a group that is dedicated to people living with dementia. So they will come to our service, and then we have a garden where they can sort of grow things and also participate in cognitive stimulation therapy. And the carers will also be there. They can be supported, and they can also meet with other carers. So advocacy is also one of the big things that we do, because most families, they may not know about what they're entitled to, and some of them, it may be relating to needing to go to a home because the families cannot sort of look after them in their own home. And others, it could be cases of abuse, financial abuse, and other types of abuse. So this is where then we work with other organizations like social development, we put social services, others social development, social workers, and then we will sort of refer them. And some family members may need support in their own rights, so then we may refer them to other services. I mean, we try by all means to engage the governments, at the national and also the local level, to be able to think about the importance of dementia. I know it's a challenge, but we keep on doing that, which is not easy. Next.
So I think it's been a nice, so I kind of started with where our challenges are, and then we went to, there is an organization with people with lived experience actually already doing things that are needed, but also they experiencing firsthand the challenges that are there. So the value of PPI and research, I think, has been highlighted, but it is to produce lived experience informed research. So people with lived experience, so people living with dementia and their care partners, being involved in study design, conduct, and dissemination of the research and development of services that affect them. So the benefit of this is that it makes the projects more relevant and appropriate for the local population. Because as researchers, we may have a question, we may feel like there's a certain intervention that has to be done, we may feel like there's a certain therapy that is needed, but getting the lived experience kind of information and insights helps to enrich what we're trying to do, which leads to the quality of improvement of the projects and meeting the needs of the community.
Okay, I mean, why do we think, participation in research is important, especially in BMF? I think a lot of carers feel that it's important, but we also educate them why we want them to be involved, because they have a lot to share, and also giving voices to carers so that they can be heard, and they've got a lot of experience, and there's also that partnership between the researcher and the people with lived experience. So we value that very, very much. Well, I think also, yeah, you go. So I was just going to say we're also very keen to get people to collaborate with us. I mean, I do quite a lot of teaching, and I invite even young researchers to be interested in research, so that we can sort of continue to improve our practice, so that people will know more about what is it that we're doing. And we're also wanting to see more people from our communities being involved in research, and also involving the carers and people living with dementia.
Okay. Thank you so much, everyone, for listening. Thank you, Suzetu, for sharing your insights and the great work that your organization is doing, but the great work that the community of your organization is doing towards research. Thank you, Ira.
Thank you so much, Zetu and Kanya. That was absolutely fantastic, and you're doing brilliant work. And I love to see the way that you're weaving in the meaningfulness of the lived experience into informing the research questions, which is exactly what we need to be doing. So thank you for that. We'll now go to our third and final presentation before the panel. Here we will be exploring PPI initiatives in Brazil, so going from South Africa to Brazil. We'll have Barbara Costa-Weber, who is an Atlantic Fellow for Equity and Brain Health, a speech and language pathologist at the Federal University in Porto Alegre, Brazil. And she'll be joined in conversation with Vanessa Oliveira Brito, who is a nurse and daughter and caregiver of her mom, who has been diagnosed with frontotemporal dementia. And she's at the University of Minas Gerais in Brazil. And they will be joined by their translator, Bebin. Over to you.
Thank you very much. I'll just share my screen. So good afternoon, I'm Barbara, and I will share with you a little bit about our experience with PPI in Brazil that is in a very explorative stage. And I will talk in behalf of all these other fellows that are working with me together in the same group. So we started to get interested in PPI in 2021, and we applied for a Connect grant from Atlantic Institute, and with this grant we could meet in person in Gramado, a city in south of Brazil, and there we had the opportunity to discuss PPI in Brazil, and we were very interested in understanding how PPI can be used in Brazil, and if we need to do adaptations, if this is different in Brazil from other countries or not. So that time we decided to do focus groups with dementia people and people with mild cognitive impairment, and also with their care partners. So we did 2 focus groups, one in Veranópolis, a town in south of Brazil, and another focus groups one focus group with caregivers in Belo Horizonte. And now we are, based on the results of those experiences, we are planning how we will use PPI in Brazil. So that those focus groups had as objective to explore the perspectives of participants on their potential participation as PPI members. So we wanted to know how they would feel as PPI members in this process. So caregivers were very, very receptive. They presented very positive reactions about this possibility, but they also presented a lot of concerns about their need to have a minimum of knowledge on the subject to exercise this PPI role. When we asked them about which research topics they think are more important, they said that they consider important to study the impact of dementia consequences on the health of everybody that's involved, not just the patient or the caregiver. Also to study division of care responsibilities, important decision-making in care, public awareness, and stigma. And we also saw that caregivers presented a great need to discuss demands not related to the objective of the focus groups. And this suggests for us that if we do PPI in Brazil, the participants, the members, they need to have in parallel other kind of psychological support, or they have received some preparation to solve these demands at the same time. When we talked to people with dementia or MCI, they have a very diverse reaction, and they presented much more concern about the need to have knowledge and preparation to exercise PPI. And about research, they said that they consider important to study access to healthcare and also education for patients and caregivers about dementia. And with our experience, we learned two important lessons. One is that PPI is very new in Brazil, is still very little explored. And the second lesson was that PPI in Brazil needs adaptations to our local culture. And now I want to invite one of our PPI members, Vanessa Oliveira, and she will tell to us a little bit about her experience in the focus groups. So, Vanessa, eu gostaria de te convidar para contar um pouco, então, da tua experiência, se você puder abrir a câmera. Como foi a sua experiência participando dos nossos grupos focais e como membro do PPI?
Boa tarde. Eu gostaria primeiro de agradecer por poder estar participando do evento, agradecer a oportunidade. Então, a minha experiência...
Vou só traduzir um pouquinho.
Ok.
Just saying good afternoon and very happy to be presenting here today with you.
Ok. A minha experiência, né, foi muito positiva. Eu gostaria de compartilhar isso com vocês. Eu estive presente no grupo focal de Belo Horizonte e o que eu posso dizer é que ter sido convidada a participar dessa pesquisa como cuidadora e também como pesquisadora, eu me senti muito acolhida.
Okay, so the experience that she had was very, very positive, and she took part in the focus groups in Belo Horizonte, in Minas Gerais, as a carer and as a researcher. And she felt very well received in this work.
Poder expor as dificuldades que a gente encontra no dia a dia, como cuidadora, ao mesmo tempo colaborar, né, com o desenvolvimento de possíveis problemas de pesquisa para estar trazendo melhoria para os pacientes e cuidadores, é muito gratificante.
So it was very gratifying to be able to expose the difficulties of being a carer of somebody with dementia, and also to be able to collaborate with some kind of research problems that might arise as well. It was a very gratifying experience.
Eu acredito que quando os profissionais na assistência, eles incluem a família, o paciente, eles abrem espaço para fala para essas pessoas, eles conseguem ter um atendimento melhor e mais assertivo. E eu penso que na pesquisa não seria diferente.
So when the researchers, when they open to carers and to patients, they're able to have a better understanding of the problems and also of how to go about the research.
Onde há espaço, né, para quem está vivendo a realidade se expressar, certamente terá mais sucesso com a questão de identificação dos problemas, a questão de mudanças que realmente façam a diferença nas questões sociais, políticas públicas e trazendo assim os benefícios para os pacientes, para os cuidadores, que a gente realmente precisa dessa atenção e dessa orientação.
So without a doubt, when including families and carers, then you can really make a difference in terms of having very correct research and identifying the real problems that will really make a difference to people's lives on the ground.
São muitas as fragilidades que a gente encontra, né? No Brasil, por exemplo, nós temos uma dificuldade com o paciente abaixo de 60 anos, que a gente tem políticas públicas que, por exemplo, se você quiser colocar o paciente em uma instituição ou para um day use, você só consegue isso com o paciente acima de 60 anos. Então, o profissional, no caso, a pessoa que trabalha, ela encontra dificuldade de ter com quem deixar o idoso em estado de demência nessa situação.
So there's a lot of fragilities in Brazil. So for example, for patients under 60 years of age, there's no support available for them. They can't be put into any form of residential care. So the people who are dealing with people in those situations need more support, more information to know how to deal with it.
É isso, eu agradeço muito poder estar participando e espero contribuir para melhorias nesse processo, junto com a equipe. Obrigada.
So thank you very much for including Vanessa. She's very happy to be here and very happy to contribute in some way to this work.
Thank you very much, Vanessa. And I just want to apologize that my slides were not changing. I think there was a delay, but that was our experience in Brazil. Thank you very much.
We appear to be having some slight technical issues with Irasima's camera. Give me one quick second. So we're unsure what exactly seems to be the technical issue or a technical fault here.
I'm back. Apologies. I may disappear again. Really sorry. I'm watching the donut of death turn around. So I will log into my phone in a minute in case I fall out again. Thank you so much for that beautiful presentation. That was absolutely lovely. And Barbara and the team, you are absolute pioneers in terms of bringing this forward to Brazil. So thank you and good luck with the work. And Luciana, of course, you're extremely involved with that as well. So let's go straight to the panel now. I'm conscious that we're running a little bit behind in time, so I'll ask all our speakers to just keep their answers concise because we'd like to get through all our questions. So I'm going to start with Eva. Eva, to you first, please. Ronan, can you take over for me if I disappear again, please? Because I think you have the questions. Okay, off we go. Eva, within the arts, which of course you're completely embedded in, working with people with lived experience is very much part of the methodology of the work. It is the methodology of the work. But this is very different to our traditional sort of health sciences approach. What do you think that in health sciences we can learn from the way you have embedded the lived experience in your arts practice?
Indeed, there's a lot in arts field which you take for granted. That's just how things are. But when we look deeper, there's a lot that could be, learned from or shared with, let's say, how we do research. A few of these aspects is the non-hierarchical approach. So in arts practice, that's your objective, to create a relationship, not do something for, but do with something. Yeah, we hear when we talk about disability rights, yes, nothing about us without us. So that's something that is indeed embedded in whatever environment you work within the arts. So that approach in the PPI context is really that the notion that there's always something you can learn from each other, and that diversity is in fact the enriching aspect. The other thing that I would mention, that the arts practice in terms of approaches, let's say photography, painting, sound, that it offers a kind of more nuance in the ways we express. And oftentimes when we talk about, let's say, the quality and access to the services and how we experience those services, those nuances are oftentimes very hard to grasp when we use traditional means of research. I respond to a question, open-ended, close-ended. And when we deal with people who have some difficulties to express themselves in words and so on, so oftentimes a picture or like other creative way to approach can give us much more understanding what exactly, we have to know in order, to shape and to deliver our research that would later on, probably impact the lives of people. So these are probably 2 points I would like to highlight.
Thank you, Eva. I think those are extremely relevant, and particularly as PPI is brought into the medical system, which are often extremely vertical in their structure, because you talked about breaking down those hierarchies, and also very discipline-based, or bound, I should say. In other words, using arts and working with arts to see examples of breaking down those boundaries. So thank you for that. I'm going to direct my next question at Yolita and then Dominikas. Thank you. What do you think are the risks of not involving PPI in research, in health sciences research?
Jolita, jūsų nuomonė, kokie pavojai būtų, jeigu mes neįtrauktume visuomeninio asmens į šiuos mokslinius darbus?
Aš manau, kad būtų dar didesnė atskirtis nuo teorijos ir praktikos, kaip tai iš tikrųjų yra.
So I think that the demands between theory and practice would become even greater.
Yeah. Thank you. I think that you've said it very concise, and that's exactly how you expressed it in your discussion so beautifully with Eva. Thank you for that, Yolita and Dominikas.
Labai trumpai ir drūtai atsakėte ir puikiai, ir taip, kaip ir anksčiau esate minėjusi. Ačiū Jums labai.
Welcome.
Perfect. Kanya, I'm going to ask you to address the next question, please. So from South Africa, what are some of the challenges that you've seen engaging PPI in your work, in working with other professionals who might not either understand or recognize the value of PPI, which you yourself have so clearly expressed as important?
Thank you, Ara. So in our setting, PPI is not really something that is used for all research. It's not, in other places, it's a rule. You have to have some type of PPI, whether it's from the institution or the funding. Whereas for us, it's not really something that is used often. So when you kind of have to introduce that to other professionals that may not understand the value of it, it may then have, they may have concerns like, is this not time wasting? Because now you need to have more groups and include people and have to always kind of explain. So things like that. Also resources as well. So they may, look at resources and look at that as well. Something else is like there are no clear guidelines. So we're grateful to GBHI, for producing guidelines that we now can also kind of use, because there are no guidelines. So, okay, we must do this, but how do we do it? Ethics and all of that. So if it's something that is not common, often sometimes people may fear to go into the unknown and then think around the challenges more than the benefits. Thanks, Sarah.
Thanks, Can you express it really nicely? And I think that's a really important point about, this potential sort of waste of resources. Whereas in fact, one of the core principles of PPI, it's exactly the opposite, is to address this idea of research waste, because we're doing research that is more relevant, research that cuts through the mistakes, because we're trying to address the way it needs to be done for the people for whom it counts, which is exactly the opposite of wasting resources.
Yeah, so rather invest the time in the beginning than at the end.
Well said. Thank you. And also thank you to Luciano and the GBHI PPI group for producing or working with everyone to try to come up with the guidelines to guide new PPI initiatives, which is fantastic. Zetu, you're next. Zetu, one of the challenges in working with PPI is that, of course, and you'll see this through, Bessie Makatini, you're constantly asking for people's time. They come as volunteers, they're donating their time, whereas most people, at least, rather I should say, not most people, the health professionals are paid. We're doing our paid job. How do you balance that, and how do you address that issue when you're constantly calling on people, which is what we need to do when we practice PPI?
I think I'm going to be honest here. I think BMF, because I've been involved with PPI myself, so I understand the value of it. It's very, very important. So I always have this conversation with the carers, why it's so important, and why we need to be involved, because this is an opportunity for them to have a voice. because sometimes if people have been marginalized and nobody's interested in what they have to do, and I recognize that they've got such valuable experience, and I want those experiences to be shared. So this is how I kind of address it. And most people, they're not so much worried about the time coming to share these experiences. I think for them it's more to do with, I've been helped, and how can I help somebody else? How can I also teach other people? How can I learn, from others? So, but we do actually give them time, what transport and things like that, because we really want to appreciate what they're doing, because some of them obviously may not be working, but I think a lot of people saying, I'll do anything to support, to contribute. So I think for us, it's never been a big issue, because they understand the value of actually being part of this PPI kind of experience. Yeah.
Thank you, Zeta. That's very heartening.
Mm.
So I think from the perspective of researchers, it's important for us to always recognize the effort that people are putting in, and to value, as we do, and we hope that we never take it for granted, what our PPI members and our volunteers are putting in to support the research and move the agenda forward.
Yeah.
Super, thanks so much. I'm now going to turn to Barbara. Barbara, from your fantastic work and the way you're a pioneer in Brazil in PPI, can you tell us something, give us an example of a transformative change that PPI has resulted in your work? What has the PPI really done that has made a difference in your work?
Thank you. So I think all researchers that were involved in this experience that we did with focus groups, we changed our way of thinking when we are planning our research. So I can give as an example, in my situation here in south of Brazil as a speech and language therapist, I was used to do research in very linguistic aspects, studying, investigating tools to diagnose linguistic disorders. And now I started to think more about the needs of people involved with dementia, not just language and linguistic problems. I started to think how can I help people to solve these demands related to dementia care, for example. So as a speech and language therapist, I started to do research with communication, trying to understand how communication between caregivers and people with dementia can, for example, impact the challenge behaviors that people with dementia have. So if caregivers communicate better, they can manage better the challenge behavior. So I started, it's a very personal example, I started to think a little bit different, and I'm including the local community and asking advices to understand how is the best way to collect the data. And I think that's it. Maybe Luciano can also talk a little bit about his experience. But I think all of us, we changed our way of planning research. Thank you.
Thank you very much, Barbara. And that relates, you explained it really beautifully, and that relates to a question that's come through on the chat from Madhu, who talked about, can you give a specific example of an advantage of PPI research? So that was nicely timed. And I think, Eva, you answered via text as well. So, I mean, it sounds like for you, it's really changed again. And for Luciano, it's changed the way you see research and the way it needs to be conducted and the position of the person within that, which is fantastic. I'm going to move over to Vanessa now. Vanessa, from your perspective, what is the added value of research, of PPI in research?
Então, Vanessa, na sua perspectiva, qual é o valor adicionado da participação público e do paciente na área da pesquisa?
Eu vejo como grande valor, né? Uma vez que esse acolhimento que eu falei anteriormente, eu vejo como muito importante, e demonstra um comprometimento muito grande dos pesquisadores em realmente estar auxiliando, né, no que vai fazer a diferença para o paciente e para o cuidador.
So Vanessa sees a huge advantage and the importance of this welcome and this receiving that shows real commitment with bringing real positive change for the carers and for the patients.
Fantastic, thank you so much. And Luciano, you're the last one on the panel before we turn to questions that anybody may have. So I'm going to, first of all, ask you a question, but I think we've addressed it about challenges that PPI may be to kind of vertical medical hierarchies. But then once you've chatted about that, perhaps tell us a little bit your experience of working in PPI and leading the GBHI Global PPI group and what you've learned from that.
Yeah, thank you, Ira. I think that regarding the aspects of challenging hierarchies, we need to talk a lot to everybody who is interested in devoting time and their energy to research. And I think that's the same thing we saw during the global toolkit we are developing. What we are trying to do is to gather as much as information as possible from all the countries and different places from all over the world. So we can collect and we can propose a real benefit to everyone who is involved. So I think that that's the goal. Just like Eva said, very brilliantly, that what we are trying to propose is a relationship, and nothing is more rich, nothing is richest than a relationship. When you propose this to the patient, to the researchers, to the physicians, you know, you can only benefit from this. And so I think this is what our experience here in Brazil and also our experience within the GBHI has brought us, a new level of relationship. Thank you.
Fantastic. Thank you so much, Luciano. So I think hopefully we brought out a number of themes here, like, for example, the diversity of the experience, breaking down disciplinary boundaries, centering the lived experience in the work that we do. And now I'm going to ask whether we have any questions from the chat, or have they been addressed, Ronan? Now, Ronan is posting 2 YouTube videos, which we've made through the group. One is of Luciano talking about his experience of PPI. Thank you very much for that. And the other one is Kanya, which I think will come up in a minute, talking about her experience of PPI in South Africa. So I think that will, again, it gives a little bit more in-depth understanding of how people have incorporated PPI into their work. And both of those are very nice to watch. So please do grab them from the chat and take some time to look at them. So I think we're actually ahead of time, which is fantastic. Ronan, I don't think we've got any other questions from the group. Oh, hang on, there was one from Helen, wasn't there? Let me just scroll up again. Helen Metzger, it seems to be a theme that if countries do offer some services that young onset persons are falling between the cracks, how can advocates move this ball forward? Who would like to answer this? People with young onset. Yolita, you touched on this, and Zetu, you did as well. Do you want to say a couple words about how advocacy can move this forward?
Jolita, galbūt jūs norėtumėte pasakyti apie tai, nes atrodė, kad jūs panašiau kalbėjote šią temą, kaip jaunesni žmonės prasprūksta per sistemos spragas, kai sistema neprižiūri jų, sakykime, jeigu atsitinka jaunesniems.
Mano mama yra pati jaunesnė, jai yra 59 metai dabar.
So my mother herself was quite young for this to happen. She was 59.
Ir tai buvo ir su sistema susiję klausimai ir su psichologais, psichiatrais. Tai buvo gana sunkus periodas pereiti vis dėlto.
Or she is 59 now, and it was a systemically difficult burden to overcome.
Bet nenuleiskit rankų, tiesiog eikit, ieškokit pagalbos, tikrai ją rasit ir visa tai yra, tik tai gal sunkiau gauti, gal sunkiau ją rasti, bet visa tai galima gauti.
What I would say is that this issue does exist, but it's not one to make you give up and let your hands down. You have to persevere and find the answers.
Fantastic. Thank you for that. Oh, Eva, your hand is up, please.
Thanks so much to what said Yolita. I would say like there's of course like the stigma is the core thing, you know, for the young onset dementia. So we don't refer for help if we don't we ignore like the problem. So the earlier we make it, we normalize that there's an issue and we need to help. So it's the better. The other thing is that maybe in the context of this event is that really to change the attitudes that lived experience is indeed like expert experience. This is expert knowledge that people may, you know, provide and that they might offer. And that's just how we make that, you know, what is the shape, what is the form that we show that this is the expert knowledge that we absolutely need in order, you know, to improve the quality, improve the efficiency of what we do. So this is, you know, yeah, this is something that really transformative with the people themselves who have the experience to see that as a value that someone, you know, might need it. But also it's a two-way street, you know, other people as well stress that, oh yeah, you have experience, and yeah, let's explore indeed like that we both agree and see that as a value. So these things I thought to add. Thank you.
Thank you, Eva. Well put, both of you. Kanyo, your hand is up.
Thanks, Ara. I definitely agree with the others, but just to add, I think advocacy and increasing awareness is really important, because other people will have symptoms and will not know what they're experiencing because the awareness is low. But also changing the picture, which is something we sometimes discuss at BMF, to say, you know, there's this stigma that someone with dementia looks X type, this is what they should look like. And sometimes that stops people from going to get help or, you know, reaching out, but because they haven't seen, you know, someone jogging or whatever with dementia, it's just this look. But if we increase awareness and increase what lived experience could look like, and that it's different for different people, that will also help in people actually just reaching out for help, and kind of breaking down the stigma, and making it seem like this is what it is, not just what we think in stage is, and you can live well and you can plan and all those things with dementia. That will help as well.
Thank you, Kanyo. I've seen a few nods around the room, so they, you know, well said. I think I absolutely agree with that. The other value is also the stigma around research, because if we want to move the research agenda forward, people cannot be afraid of it and have to recognize that the value it has for them and the range of research. So in other words, this idea that, you know, I don't want to be treated as a guinea pig and researchers are, you know, evil people who want to do things to me. PPI can help move that forward by demystifying research and saying that there's something for everybody, whether it's a clinical trial or it's observational research or it's survey research. So again, it's destigmatizing research can also be really valuable if PPI is deeply involved. So with that, people, I think we've got no more time, but thank you very much for your involvement. Thank you very much to our translators, our interpreters rather. You've done a beautiful job and made it very clear for us. So appreciate that. And most of all, thank you to all of you for doing a fantastic work in moving the PPI agenda forward, because I think you're really breaking new ground. So thank you. And thank you to our audience for joining us. Good night.
Thank you.
Yeah.
Thank you. Goodbye now.
Bye-bye.
Obrigada, tchau.
Obrigada. Thank you, Vanessa. It was great. Thank you, everybody. Beautiful.